bringing the rural poor together in building their own future, touching every aspect of their life, social and economic, health and education. That's TCT, Thirumalai Charity Trust, started in 1970 by the Thirumalai Group of Industries, empowering, motivating and involving people within the community in planning and progressing towards a better, brighter tomorrow.
In all our community initiatives, we facilitate development through volunteerism, women empowerment and community action. As you go through TCT's programs, you will be able to realize this. Our volunteers, mostly women, have taken on many roles. They act as the bridge between the community and us. They provide first aid. They are engaged in awareness education. They identify those who need help and direct them for assistance with the government and us. The village volunteers provide local support to bring the people together. The people are then formed into action groups. We train our volunteers and action groups in improving their lives. Whenever the people are ready to take charge, whenever the aims are achieved, we withdraw from the activity. Our staff directly reach out to more than 25,000 families in 225 villages.
Vellore is one of the many villages in the Vellore district of Tamil Nadu where TCT, Thirumalai Charity Trust, has been active. Working through well-trained and highly motivated volunteers who have been the true catalysts of growth and have involved the local community in every developmental activity. This health centre, built on a land gifted by the local community, offers comprehensive health care to people in as many as 10 villages in the area. Education programs for women and school children have helped in improving awareness of maternity and child health practices in the village. There has also been a significant improvement in hygiene and sanitation. Evening Study and Recreation Centre for Children has improved their study and life skills. Over 60 women involved in self-help groups have used microcredit to improve their housing and to supplement their income through milch animals. They have become literate by attending literacy classes. The women of this village contributed their free labour to build a kitchen for the village school. They also built latrines for their households and soak pits around the community borewells. They participated in a campaign to save grain and built a grain storage kothi in their homes. Well-trained in sustainable agriculture, the women are growing paddy, ragi and groundnut. And kitchen gardens yield vegetables for their daily requirements. All this has earned a better status for the women in the family and in the community, and brought immense satisfaction and pride to the people of Vellore. Today, TCT's activities cover several more villages, touching the lives of people in several more ways, such as caring for the disabled. TCT works with voluntary organizations to rehabilitate disabled people by providing surgery assistance and mobility devices, and by helping them form self-help groups and access various benefit schemes offered by the government. Special children deserve special attention. TCT facilitates admission in daycare centers and special schools for children with cerebral palsy and mental retardation and the hearing impaired. Parents are also trained to manage their children's disability. The mentally ill in the villages are identified and treated in camps. Their caregivers are also given training to care for them at home. De-addiction and rehabilitation of alcoholics has been a focus area at TCT for nearly 20 years. The comprehensive treatment is done in a 15-day residential camp and covers medical treatment, counseling, family and social sensitization. There is a continuous follow-up for a year. Some of the treated alcoholics recover very well and become contributing citizens.
பள்ளிக்கப்போ ஆனந்தன் என்னுடைய வயசு 16 நான் குடிப்பழக்கத்துக்கு அடிமையானேன். குடி என்பது அளவுக்கு மீறி குடிச்சிட்டு தெருவில் வீழ்ந்து கண்டபடி பேசுறதுக்கு உடம்புல துணி இல்லாத அளவுக்கு நான் அதிகமான அளவுக்கு மற்றவங்க பார்த்து என்னை அசிங்கப்படுத்துகிற அளவுக்கு நான் குடித்தேன். நான் சாகும் கட்டத்தில் போகும்போது என் மனைவி ஏற்கனவே முன்னால் திருமலை அறக்கட்டையில் ட்ரீட்மெண்ட் எடுத்தவர் ஒரு ஆளை போய் பார்த்து ரங்கநாதன் மூலிமா திருமலை அறக்கட்டையில் என் முகாமில் சேர்த்து 15 நாள் நான் ட்ரீட்மெண்ட் எடுத்து 2000 வருஷத்தில் வெளியே வந்தேன். கோயில் ஆரம்பித்து வெளியூருங்களெல்லாம் பணத்தை வசூல் பண்ணி சிறப்பாக 2 வருஷத்தில் கோயில் கட்டி முடித்து ஒரு நல்ல பேருக்கும் மற்றவங்க பார்த்து ஒரு நல்ல அளவில் என்னை முன்னாடியாக கூப்பிட்டு உட்கார வச்சு செய்யக்கூடிய ஒரு மதிப்பும் என்னுடைய குடும்பத்தில் நல்ல ஒரு முன்னேற்றமும் மகனுக்கு திருமணம் செய்தேன். ஒரு 15-16 சவரம் நகை எடுத்து வச்சுருக்கிறேன். மற்றவங்களுக்கு நிலமாக வாங்கியிருக்கிறேன். இப்போ நான் திருமலை அறக்கட்டளை மூலியமாக நல்ல ஒரு முன்னேற்றத்தில் இருக்கிறேன்.
Over the years, people's awareness and aspirations for a better quality of life have grown. Because of its 3 decades of engagement with the people, TCT was able to track these changes and feel the pulse of the community to have a good hospital to meet the secondary healthcare needs in the region. TCT started Thirumalai Mission Hospital in April 2010 to make high-quality healthcare available and affordable to all the people in and around Ranipet, where it has been active for 3 decades. The hospital, located on a 5-acre plot, is designed for 20 beds to begin with, growing to 150 beds in 5 years. Equipped with modern facilities, the hospital provides a comprehensive range of services through a team of highly qualified and experienced surgeons and physicians. Diagnostic facilities for X-ray, ECG, lab, and ultrasound are offered. The hospital has a septic theatre, a good operation theatre, a labour room, and an intensive neonatal care unit. There is also a physiotherapy department. Private wards and general wards are available for inpatient care. The medical services are strengthened by various support services. Primary health care is offered in the form of mobile clinics that provide outpatient treatment and minor procedures. Training is an integral part of the hospital. All cadres of staff go through induction and orientation. Every aspect of the functioning of Thirumalai Mission Hospital is guided by a quality policy that stresses on transparency, ethics, and adherence to good, standard medical practices. The vision is to have a comprehensive healthcare system that will provide world-class service, which will progressively grow to be a premier healthcare institution with tertiary care facilities and also develop into an educational and research institution.